Welcome to the American Academy of Grief Counseling's video on assessing complications in grieving. And this video should be really paired with our earlier video on complicated grief, because in essence, it is dealing with complications in grieving and what complicated grief is when a normal grief reaction goes pathological. So when we look at grief counseling itself, there is a purpose, and the purpose is to help individuals navigate and to properly adjust through the process of grief within the normal parameters that exist within it. All the same, respecting the uniqueness that exists with each individual person's loss. So while the grief counselor sojourns and guides the bereaved, there needs to be a ensurement that the bereaved is following a proper normal grief trajectory. And again, when we say a proper grief trajectory, we're talking about a type of trajectory that is common within the human experience, with some exceptions with individuals who might experience some unique elements of the grieving process itself. Now, when certain behaviors exhibit, certain symptoms manifest, well, then certain assessments need to be made if they are not corresponding with the proper grief trajectory. So in these cases, if the grief counselor is a non-clinical counselor, but only a pastoral counselor helping someone through a loss, these are the times when complications emerge that a non-licensed grief counselor would have to refer this client to a clinical counselor who is certified in grief counseling, or maybe not even certified, but they are still nonetheless clinical. So in the process of helping individuals through grief, grief counseling helps individuals through the normal trajectory, but it also stands watch to ensure that those grieving are grieving in a way that is within normal trajectories. And when it goes off course, then we fall into an area of complicated grief that sometimes requires therapies of various effect. Now, not all losses are the same. Some losses inherently are more susceptible in their very nature to complications. And some individuals might be less resilient or have less support systems to be able to handle a loss. They will not be able to cope as well as one other person might be able to cope. So each case is unique, but each case still needs to be monitored regardless of the type of loss, to ensure that it is following the proper trajectory. So grief counselors need to watch for various signs when trajectories go wrong. Beyond the acute phase of grief, which is usually within the first 6 months to a year, if one continues to see signs of depression in one's client, or a loss of appetite, poor sleep habits, a social withdrawal, a lack of interest in meaning itself, and an emergence of various maladaptive coping strategies such as alcoholism or drugs, then these should be seen as red flags that the grief is beginning to become pathological in nature, that it is taking a turn for the worse. So types of red flags to look for, what we refer to as abnormal reactions. Well, what is abnormal well beyond the loss and grieving period is usually normal immediately. So don't mistake intense grief as a red flag if the person is still grieving within the first few months. But if it's been years later, well, then this type of intense pain where the oscillation of emotion is extreme, not spread out, but constant, well, then that's a sign that there is an adjustment to this particular loss that has yet to be made. In cases of denial, is the bereaved unable to accept the loss at all? Does the bereaved cling to various possessions, avoid certain places where the deceased once habited? Or does the bereaved refuse to completely discuss the loss in nature? In regards to emotions, is there a presence of severe anger or guilt or sadness that still manifests at a very escalated level, well beyond the regular grief trajectory? And are these emotions, are they tied to maybe unresolved conflicts or thoughts that exist about the loss or with the deceased individual? Many times, an unresolved issue at the moment of death can lead to great guilt between the bereaved and the deceased, and this can carry on throughout the grief trajectory in a negative way. In regards to the bereaved's meaning, is bereaved able to find meaning in life? Or is the bereaved in a complete state of what we would refer to as depression? Does the bereaved find no meaning in life itself or no direction that they may find? So meaning is important. And that's one of the things with Robert Neymeyer that is emphasized in grief adjustment, is that the individual is again to find meaning in life and to find how the loss fits into the particular life story of the individual. When this is not able to be accomplished, then the individual loses meaning and kind of falls into an existential crisis of types. In regards to readjusting and finding acceptance in the loss, is the bereaved able to make new connections? Is the bereaved able to connect the past with the present and the future? And is the bereaved suffering with maladaptive coping issues? So when we look at denial, the expression of emotions, finding meaning, readjustment, and acceptance, how are these important and critical elements in the healing process going forward? And when we see examples of what we just listed occurring instead of healthy readjustments or healthy emotions or acceptance, we can understand that there probably is more going on that needs to be addressed at a much deeper clinical level to help this individual find the healing that this individual needs to proceed forward. So this is just a little bit on grief trajectories in regards to leading signs that go to what we refer to as complicated grief. AIHCP and the American Academy of Grief Counseling does offer a course on complicated grief. It's GC 500. And we also have other blogs on this particular subject. I wanted this particular short video, though, to look at, in particular, just some trajectories just that we need to be aware of, that we need to watch. Below is our link to our grief counseling certification. Our number is 330-652-7776, and our email is info@aihcp.org. So please review, and everyone have a good day. Thank you.